Hello, everybody. Welcome to Raising Multilinguals Live. My name is Tetsu Young, and I am from Ask Tetsu.
Hello, and my name is Uteli Macharibot from Uti's International Lounge.
Hello and welcome. My name is Rita Rosenbach from multilingualparenting.com. And today we have a really interesting session on the topic of bilingual children. And if you think that your bilingual child is late to talk, I'm so happy that you could join us, Mary Pat. You are a speech and language therapist. And could you please tell us a little bit more about what you do and about your experiences?
Absolutely. I'm delighted to be here and thanks so much for inviting me. So I am a speech and language therapist, as you said. I'm based on the west coast of Ireland and I'm a lecturer in the university as well, training students who are doing an undergraduate degree to become professional speech and language therapists. So I teach there about children with speech sound disorders, and I teach about linguistics and as it applies to children with language problems and speech problems. And I start in first year, the first day they come in, talking about multilingual children, because I also teach about assessing speech and language in multilingual children and working towards intervention goals for children who have speech, language and communication needs with them.
That sounds fantastic. What we need to keep in mind is that some of our listeners may not have English as their native tongue, so let's not put the Irish oomph on to speak too fast.
That's funny. I thought that was slow.
That was. I understand that because I know how you know, but it's good. We want everybody, because this is such an important topic and it's so interesting. So we want everybody to be able to follow it. So I would like to start with the big question that I see it come up, I get it asked, and that is, does bilingualism cause language delay with children?
I think I should have got a t-shirt that just said no on the front of it and worn that, because that is the simple answer, Rita, to that question. It does not cause any speech, language or communication impairments. The research backs that up like without any doubt. And all the professional speech and language therapy associations, like in Ireland, in the UK, Australia, New Zealand, the USA, Canada, support bilingual language development in children and where there are difficulties, and take the stance that it does not cause problems.
Well, I think that's it, everybody. Thank you very much. That's the end of the talk today. Well, I do want to take one moment to acknowledge everyone that's watching on our Facebook Live right now. We have quite a few people watching. We have quite a few comments also from Elena. Hello from Iowa. We have Manuel, says, now I can see you. So hello from the Netherlands. So thank you, everybody. If you have any questions, do put it in the comments below. I don't know if it's below or beside, but do put it in the comments section, and we will be picking them up. And as we go on with the interview, we will feature your questions also. Okay. So thank you very much.
Fantastic. So yes, we could have stopped there, but of course, just because bilingualism doesn't cause language delay doesn't mean that parents of bilingual children do not have this worry, and maybe there even could be a problem. So, but what does it mean? What does late talking mean? What do parents need to be aware of?
Okay, so I think probably before I answered that, there's three important things to remember about language development in multilingual children. And the first one is about individual variation in early language development, and that, you know, all children are unique, and the constellation of languages in their family, for instance, the society they live in, varies for every child and every family. So individual variation is a hallmark of early language development in children in general. And then for multilingual or bilingual children, obviously there are other factors that kind of come into the equation, like the number of languages, the relationships between the languages, if they're very similar or very different, the ages at which they start speaking the languages, and their opportunities, you know, to use them, for example. So that's the first thing. The second thing then is that the languages do influence each other and they interact with each other in ways that we can't always like predict. So that's another kind of feature of early language development in multilingual children. And then the final one is that if we think of monolingual children, they are learning all their speech and language skills in one language. So it's kind of like a straight line up of development. Whereas with multilingual children, because they use the different languages for different reasons with different people and in different contexts, you get like uneven or distribution of skills across the languages. So a very basic kind of example is if a child would have vocabulary for things to do with home and family relationships in one language, and then they would have the vocabulary in another language, we'll say in preschool, for instance, and they wouldn't necessarily, not expecting them to have the same vocabulary items in both of their languages. So that's a really important thing to remember, those three things first. And then when we talk about late talkers, there are a couple of definitions. So generally, it's taken to mean a child, let's say, for example, who is developing typically in terms of their physical development, their hearing, and so on and so forth, and they seem to be understanding everything that's said to them. But between 18 and 30 months of age, they're not saying many words. Okay, so that's one way of looking at what's a late talker. I'm just having a look. I had to write it down because I find it hard to remember the numbers, you know. So they'd be using a limited number of words between 18 and 30 months, but understanding everything. At 24 months, if they had less than 50 words that they were using, that would be considered language delay. And just to give you an example as well, like typically developing 24-month-olds in theory are supposed to have about 50 verbs and then learning 8 verbs per month. But we must always remember the individual variation. That's really important. These are kind of, you know, general signposts, but not like written in stone for each child. And another kind of thing to think about is if at 30 months a child has not started to combine words together, that's also considered like late talking. And the last one is you can have children who have delayed comprehension as well as delayed expression.
Well, while we're in the definitions, is it okay if I just add a little side question to that? Are there patterns in this lateness across different languages? For example, certain languages, you know, they consistently start later or earlier. Have you seen that kind of study?
That's a really interesting question, Tetsu. And another issue in this whole area is like the gaps in the research. So like there is no kind of, you know, one size fits all. And like I couldn't tell you like a specific study now that's looked at that. I'm sure there is like, you know, research on different language pairs for definite. And there is like a European kind of research group that were developing tasks to measure vocabulary. Let's say there's one being developed for Irish, so you could do it in Irish and in English. So that research is kind of ongoing, and I wouldn't be familiar with like the nitty gritty. But that comes back to the point about the uniqueness of each family constellation in terms of the languages, you know, that the speech and language therapist would have to bear in mind when doing an assessment.
It's encouraging to hear, though, that there is more research into it and that these tests are being developed for different languages. So
and I think, yeah. And I think the point about that, Rita, is that from like I'm a researcher and a speech and language therapist. So from the speech and language therapy point of view, the frustrating thing is how long it takes the research to actually filter down into clinical practice. And so I'm working on some like measures to assess language in multilingual children, but they're not available like to speech and language therapists to use it because we have to make sure that they work well and that they identify what we want them to identify. So, you know, it takes time, so that can be a bit frustrating. However, there are certainly enough measures out there for speech and language therapists to deliver a culturally competent service to their clients.
May I ask something, because you just mentioned the numbers, right? When a child is like 24 months old, that they should have like complexively in all their languages 50 words. I often get asked what is a word, right? So is it something that everyone outside in the world would understand, or is it also the words that a child would at that age use? For example, na for banana, right? Can you tell us more about how to count them? Because I think that many parents get a little bit stressed about this because they say, well, my child doesn't really speak or doesn't really utter these words in a way that everyone would understand. Only I do, or we in the family.
Okay, very interesting question, Uta. And there are two things I would say. One is that, for example, making animal sounds, so whatever that is in your language for what the dog or the duck says, whatever, does count as first words. So, for example, there is a measure called the MacArthur-Bates Communication Development Inventories that counts the words that children use, and they count animal sounds as first words. I would say my own daughter's first word was actually a sound. She used to walk over to the computer, point at it, and K meant, will you play Katy Perry's Firework? Because when Katy Perry sings Firework, she emphasizes the K. So that stood out. I count that as her first word. So the technical kind of definition of the first word is the same sequence of sounds to refer to the same thing every time the child says it. So if they say na for banana, every time they see a banana, that counts as a word. And you're absolutely right. Like every family has those kind of idiosyncratic names for things. I think they're really cute. And again, like an example of the creativity of language development as it's happening naturally.
It's very different across languages also. So
Yeah,
obviously something that's in Japanese is very different.
I think I think you mentioned it briefly, but these, when we say 24 months and 50 words, we are counting the words across all the child's languages. So if a child says, gives the name of a duck in one language and in the other language, that's actually 2 words.
Oh.
Am I right?
Absolutely, yes.
Oh, wow.
And with the MacArthur-Bates word lists, that has been developed across a range of languages, and of course the words in each list for each language are different because culturally they have to be, they have to be culturally specific. So first words in English won't be the same as first words in Irish or first words in Dutch or whatever it is. So like if a speech and language therapist was to use those tasks, realistically you'd have to contact, let's say you can Google the site, and then you'd have to contact the person, let's say, who produced the Polish version. You'd have to work to get a copy of it, let's say, and then work with an interpreter. The parents fill out the measure. So there are, things, as I say, the speech and language therapists can do, but you're right, you need to count the total number of words.
Okay.
But I really don't want people to get like caught up in 50 words, at 24 months. Everyone is different, and the main thing actually is to see your child making progress and also communicating, because it's not enough. Children can be extremely communicative before they ever say their first word, and that's what I would be interested in as well, is how are they currently communicating and what are they doing with the sounds and the words that they have in order to engage with another person.
Yes, absolutely. Very, very good. Very, very good point. So, like we said, bilingual children are not immune to being late talkers. They can, just like monolingual children, they can be late talkers as well. So when this happened to a bilingual child, based on your experiences, do all the languages have a similar delay, or how does that work?
That depends on the amount of exposure and the opportunities to use each one. So what the speech and language therapist can do there is there are, again, parental questionnaires that kind of try to create a profile of the family in terms of who is speaking what language to who, how much of it is being spoken, how much television are they watching in that language, who do they need to speak the languages with, so that, generally speaking, if there is a delay when it comes to language and multilingual children, you see it in all of the languages. But again, it's not like a blanket kind of a thing. You have to look at the amount of exposure, the number of opportunities to use the language, and then look at, let's say, what are they comprehending and producing in the languages.
Very good.
Yes, I think you were already almost answered the next question that I had that we had thought of is kind of what if a bilingual child or it feels like the child is late in only one of the languages, or let's say in the school language, or
Then you would need to look at, again, it's really looking at the profile of the amount of exposure and the opportunities to use it. When it comes to the school language, let's say, for example, if the child has only been exposed to the home languages until they start school, it's really important to remember how long language development takes. It's a very complicated process, and like it depends again on where you read, but you know, they talk between 3 and 7 years in terms of school language, because if the child is starting let's say school in a language that they don't have much or little exposure to, they have to kind of catch up with, I don't want to say catch up because that's, you know, yeah, they're learning. Let's say, for example, when I went to school, I learned French through my dominant language. I learned French through English. I didn't learn French through French. But if you were starting school in English, let's say, and you haven't been exposed to it before, you were learning a new language through the new language. That's hard, and it's not fair, I think, really, and it takes time. And also the academic vocabulary, the language of school for different subjects. You're learning the concepts of, let's say, what is weight, what is height, what is distance, for instance, and then you're also learning the language to go with it. So there's an awful lot going on. So not to be surprised that it takes a long time.
Yeah, you're describing the experience that my 6-year-old daughter had when we moved from Finland to the UK, and she didn't know a word of English and went into straight into school. So yes, it's, absolutely.
I have a question about, let's say that the child has been assessed and is a late talker, okay, is a bit late. And then the parents are advised maybe to do some exercises or to have certain kind of interactions with the child in order to foster all the languages, talking about a multilingual family. Is there any kind of different development of late talkers compared to not late talkers later on, let's just say when they maybe start school or when they are even teenagers?
Yes, I had to write that down as well. So great question, Uta, in that. So what happens to children who are late to talk? And again, it depends on what you read, and it is interesting. So what the research shows is that about 60% of children who are late talkers catch up with their non-late talking peers by the time they're about 3 or 4. However, they perform in the average range at that point, let's say on language testing, but they tend to perform at the low end of the average range compared to children who were never late to talk, if you know what I mean. So it kind of suggests that there may be a slight kind of, how would I say, like weakness when it comes to language ability in general. So the idea would be that you would need to keep an eye on them. And then at age 7 of children who were late to talk, 20% were found, in one study I looked at, were found to have trouble with grammar. And in about a third of the late talking children, they have persistent problems. On the other hand, right, you can have a language disorder, what's called developmental language disorder, and not have been a late talker. So late, like, it does, if your child is a late talker, it doesn't mean they can't kind of catch up and come into the average range when it comes to language. It's just it's difficult to predict who that will be, if you know what I mean.
Yes, so if I understand you well, so if a child is a late talker, is there a higher possibility that the child has some kind of learning difficulties later? Or
Not learning difficulties, because you mean like a developmental language disorder? Again, I'd have to go back to the research, because as I said, you can have a language disorder and not have had any signs of a problem, you know, when you were younger. Now, in terms of, actually, I did look as well at, just to remind myself of what are the risks of not growing out of being a late talker. So the kind of risk factors would be if the child has comprehension problems as well as expression. So by expression, we're talking the words they use and combining words into phrases. So if they have difficulties with understanding, if there's a positive family history of speech and language problems, and if there's a lack of gestures in their early communication development, those are kind of like red flags for it going on to be more of a protracted kind of a problem.
So just to I think to really make it clear for some of our viewers, we do have comments like, is late talking common in multilingual children? So we have addressed this at the beginning in that no, there's no research that supports the fact that bilingual or multilingual are consistently late talkers. This is just as much a monolingual problem as it is for bilingual. So everything you've described so far is for late talkers per se, not necessarily bilingual or multilingual late talkers. It can be monolingual late talkers, right?
Mm-hmm.
Yeah, absolutely, because the issue is kind of above, languages. It's like it's difficulty with language as a kind of an overarching concept or thing,
Yes.
Absolutely, and it's important to reiterate that because we will have listeners tuning in the middle of things. So
I think it is one of our biggest fears as parents who want to raise bilingual and multilingual children. It's one of the biggest potential downside that lots of people talk about, and that we fear that by doing this we're harming our children, and in fact there is no research that backs it up. So,
and I think, Tetsu, it's such a powerful myth, I think, and a long-lasting one, because there's such a monolingual bias, like in relation to, let's say, speech and language therapy, in education. So like I can totally see how people come to be worried about that. Indeed. Because, like, for example, I had a phone conversation recently with a woman, a mother of a monolingual toddler, and who was late to talk, and the public health nurse told her the child was lazy. So, you have professionals, whether no languages involved, who are, who issue advice or make judgments not on the basis of any evidence. So, it's very difficult.
Yes, we'll come to that later on when we speak about what you would like to see in the training of future speech and language therapists. But let's say that that your child has been diagnosed with being a late talker. So what can parents do? How can they help their children?
Okay, so I think really and I know we're going to come to this later, but if you are concerned, I do think it's important to speak to a speech and language therapist, because, we're the professionals who are trained to identify the language delay, and also to assist parents to kind of work with their children to improve their language development. So that would be my first. Of course, I know I would say that because I'm a speech and language therapist, but it would be like, that would be my advice. And then what we do is, obviously, we do the assessment, taking all the languages into consideration, and then we should be collaboratively setting our goals. So discussing with the parents, like, what are you most concerned about? What do you want your child to be able to do? So is it, for example, they don't call you mama or papa, or if they don't say your name, is that something you'd like to work on to encourage? So that you work out what are the goals for the family, and then work out the techniques for how to achieve that. And with the late talking children, really the intervention is primarily through the parents, and working with parents to make sure that the communication environment is like optimum for building language development. I'll give you an example, actually, of a woman I met on the bus pre-COVID, who had a little boy and she was worried he wasn't talking a lot. And I was saying to her, oh, just tell me a little bit about, let's say, if you're having dinner and he wants more, how does that work? So she described how he would point at what he wanted, he would vocalize, and actually, no, he wouldn't vocalize, he'd look at it and she would just give it to him. And I was thinking, oh, that's so interesting, because those are the opportunities where you can add the language in. So you say it as if the child could, you'd say what they would say if they could. So in that instance, she could look at the bowl, will say, and say, oh, your bowl is empty. You want more pasta or whatever it is. And that, you know, and ensure that there are turns being taken and that you're adding in the language. And it does mean like really kind of slowing down, I think, your interaction and observing where are those opportunities where you can add language in and where you can pause and not anticipate the child's needs. Because of course, as parents, we're so tuned in to what they want. She knew what he wanted. She just gave it to him. Of course, like that's totally natural. But where you're concerned that they're not talking, we have to kind of work a bit to create opportunities where they can actually vocalize, and then you can say the word as if the child would say it themselves.
Great. I mean, you did mention that yes, parents should get in touch with speech and language therapists or pathologists, as they are called, as well. One thing I always remind parents is that please do your research. So make sure that whichever professional you're in contact with, that they are used to dealing with bilingual children, and don't be afraid to go to change therapist if you're not happy, if you don't feel confident that the therapist is actually capable or sometimes willing to accept that multilingual is normal and all languages need to be taken into account.
I agree. And you know, Rita, I think it's very difficult as a parent. You're very vulnerable, especially if you are concerned about your child and you're encountering, we tend to assume that the professional kind of knows what they're at. And I, like, from my own personal experience of meeting with, public health nurses in relation to my own daughter, and, teachers, where I realized afterwards I had projected really an awful lot onto them, that where I really took their word as gospel. And it took me a while to go, oh, hang on, no, I know my child, or I don't agree with that, or but I felt quite disempowered, and I was quite shocked, because I was like, I'm a healthcare professional myself, and yet when it's my own situation, it was a different kettle of fish. So I have actually on my blog Talk Nua, I have 2 blog posts for parents where I have very specific tips for what to say in that instance, because you can just be blindsided by the professional saying, you're confusing your child, or you're causing them harm or whatever, and you could be so shocked in the moment that you don't know what to say. So I have a range of kind of going from very indirect or not saying anything to more direct and assertive, because I think it depends really on the individual and where they're at and their own like personal style of interacting as well. But I agree with you, like, you don't have to stick to the therapist that you have encountered, and like they are under an obligation professionally to follow best practice standards.
Yes, what we'll do, we'll add to the post that you mentioned, we will put those in the comments, and we will also add them to the show notes, so anyone watching repeat will find them in the show notes.
Great. I just have one other thing to go back to about parents and what they can do. So I've talked about what you can do in terms of, the everyday opportunities. And here's something, if you find yourself doing it, to stop doing is, where if you feel anxious about your child's, talking, we can get into kind of a testing discourse where we say, what's that? What's that? And what's that? So the problem with that is if the child doesn't know the name for the thing, they can't give you an answer. So then it can become a frustrating kind of an interaction, and you know the answer, so it's not naturally communicative. So if you find yourself doing that, and we all get into the habit, it's good to kind of pause, and instead of asking what's that, you tell them the name for the thing.
So natural discussion, and no testing.
No testing, yeah. And look, if you test now and again, don't worry about it. But like, I don't want parents to feel under pressure, but just to kind of observe yourself, kindly, and see, oh, does that help, or would I tweak that a little bit?
Right. Great. I'm sure we have a big audience. We have questions, Ute?
Yes, we have several questions. Actually, Maripat, you already answered one question from Adel about how we can encourage our children to move from pointing and making sounds to making sounds for the words. You answered this question before. But there is another one from Elena Ivanov. Hi, Maripat, could we alleviate the possible late speech frustrations with introducing little kids to sign language? Thanks a lot for doing this event.
Okay, great question. And you know, I was thinking about this earlier as well. So from my point of view, natural gesture is very important in relation to speech and language development. And I have a blog post as well on baby sign, and I looked, you know, at the literature and what does the research say, and you know, because I was curious, and like at the moment there isn't enough high quality research to say it's necessary or that it's particularly beneficial. But the natural gesture is what children do anyway. And there's an American researcher called Amy Weatherby, and she has a First Words Project website, and she has some great resources with like 16 gestures by 16 months. And there's a list of like they're in sequence of when you would expect them to emerge. So you could look at that, but they're not necessarily culturally sensitive to every culture. So you'd have to look at them and see, does this fit with how we use gesture? I think with the baby sign as well, I just don't want parents to feel guilty if they can't afford it, or guilty if they don't have the time to do it. I don't think it's necessary. I think with the gestures, you can start by observing your own use of gesture and what gestures do you use. Observe the gestures your child is using. I'd have a look at the Amy Weatherby 16 by 16 then and see what ones could we introduce, because gestures do predict language development. So when it comes to, you can have gestures, let's say for example, if the child sees a biscuit and they see the biscuit and they rub their tummy, that's one message. So it's like they're hungry and they see the biscuit, you know what I mean? Whereas if they look at the biscuit and say, let's say they see the biscuit and say now, that's like two messages saying, I see the biscuit and I want it now. So there were different it gets quite complicated, but there were different kinds of gestures. And the one where the two ideas come together are more sophisticated, because that's like a prototype for, you know, combining words, because you put two ideas together, which is what you do when you put two words together into a phrase. And then with verbs, the verb word tends to come first and the gesture comes after it, whereas with nouns, the gesture tends to come first, and then 3 months or so later, the word will come. But as I say, Amy Weatherby stuff is very good on that, I think.
Yes, and I think, isn't it so that those who do learn baby sign languages, especially in multilingual families, I saw this used so that if maybe the partner doesn't speak the partner's language and they have a word like for more, and they do this movement that very young infants can already do, that the other person can understand as well what the child means, so that through the gesture, the different languages can also somehow be combined and make it easier for the rest of the family to understand what the child needs or wants. Of course, gestures need then always to be combined with words, so it's not a non-speaking kind of gesture, but one would respond by saying, oh, you want more of, I don't know, milk or something.
Yeah, absolutely. And I think really, you know, my bottom line on it is, look, if you want to do it and it works for your family, absolutely. But if you can't afford it, you don't have the time, you don't have the access, don't worry, because you're not how would I say, you're not neglecting. Yeah. And the other thing I think as well in relation to, because I think what's probably going on with the baby sign is actually really tuned in communication between the parent and the child, because they're really observing and they're really working very hard to actually work out the message. I also think that children do need to learn about communication breakdown and communication repair. And as communicators, we have repair strategies, and we need to learn how to repair miscommunication, and we need opportunities in order to do that. I also think in relation to feeling frustration, that I did a course a number of years ago in developmental psychology, and a Canadian actually neuropsychologist or developmental psychologist, rather, sorry. And his point was about like the importance of going through the frustration to get like to the other side of it. And we don't want to bypass necessarily emotions that are kind of challenging, because then we've lost the opportunity to actually learn how to handle them. So that's kind of where I'm coming from. But as I say, I just don't want people feeling bad because they can't afford it.
Yes,
Absolutely.
we have another interesting question from Matthew, who asks, does a pacifier delay speech progression?
Oh, a great question. And I have a blog post on that as well. So the evidence is kind of conflicting about it. Some of the evidence says if but around the second year, you need to kind of phase it out if you can. I think the thing about the pacifier really is the judicious use of it. So what can happen is you use the pacifier because it just works for you. And then what can happen is I've seen children with the pacifier in, let's say on the bus, for instance, they're not actually in need of soothing. It's a habit now, it's in their mouth, and they're talking with it in their mouth. And, you know, or I had a friend who had like, her child had 3 soothers on the go at one time. So like the literature is mixed about whether it causes delays or not. And my advice would be, look, again, if it works, if you really need like the soother to help pacify or soothe the child in particular contexts, fine, but just make sure that it doesn't get in the way of communication, and that it doesn't kind of what would I say, cut off opportunities to interact with your child.
Yeah. There is another question also from Matthew. Is it common to see a child say a word and then proceed to never use it again?
Yes, in early child language development, it is not uncommon. Now, I couldn't tell you specifics in terms of, you know, how uncommon for children to use words and then kind of, let's say, like forget them or not use them again. Yeah, because inconsistency is kind of like a hallmark of a developing system. So they can kind of come and go. And, you know, you could look at, again, opportunities to use the word in terms of does it get stored or not. But that's not uncommon. Yeah.
Yes, thank you. There is another question now from Andrea. What happens during an evaluation? What does the therapist do?
Okay, great question. And actually, I am teaching third-year speech and language therapists about this very topic at the moment. So that in terms of, you know, the education of speech and language therapists and what's happening. So ideally, right, the speech and language therapist will discuss with the parents what are the main concerns in terms of the speech language. And then there'll be a series of questions about, for example, early development. Was there anything unusual in the pregnancy or the birth? Was the child premature, low birth weight? How was early feeding, for instance? And then they'll ask questions about if, like, when did the child sit independently, when they began to walk, toilet training, you know, that kind of case history information, we call it. Part of that would also be like, tell me about a typical day in the child's life. Tell me about a drop off at preschool, or, you know, when they come home from school or whatever it is, to get a sense of the child's life and the context. With the multilingual children, there should be the profile, the parental questionnaire about the profiles of who's using what languages to speak with whom, the amount of exposure, opportunities, all of that. And then depending on the age of the child, if we're talking about late talkers and the toddlers, it would be, let's say, the developmental, the MacArthur-Bates communication development inventories. There is the language use survey, which is also available in a range of languages, and those measures should be done in all the available languages. That may require an interpreter. And then in terms of, let's say, they'd be observing the child playing maybe with the parent, interacting with the parent, and then maybe writing down, let's say, what the child was saying or doing. There is another checklist called the pragmatics profile, where you can look at the functions of the child's communication. Are they requesting things, rejecting things, greeting, labeling, commenting? How are they doing it? So you really want to get an overall picture, you know. And then in terms of comprehension for the 2-year-old, there are things like, it's called the symbolic play test, but play is culturally specific. So this is designed for, you know, Western children, but it looks at how children play. If they're saying words, excuse me, you would be writing down the words they say and how they pronounce them. And you'd be asking questions about hearing. So that would be kind of your first session, you know, to kind of get a lay of the land and see what are the main concerns, and, you know, across the languages then as well, how the child is, you know, communicating.
Thank you.
Thank you. That was fantastic. Did you have any more questions? Yeah, sorry. Did you have anything else you wanted to add, Merita?
Yes, just to say that in relation to the evaluation, it probably would last more than one session.
Yeah.
You know, because depending on the age of the child, depending on how the services operate, and it takes time. And you see, of course, now in the COVID world, there's a lot of teletherapy going on. So it would be like via Zoom or whatever. So that's, you know, different as well, but it would take more than one. And that sometimes the diagnostic process can take a while because there were so many factors to consider. You mightn't necessarily get a clear-cut, definite, this is definitely the diagnosis. You know, after the first session, it might take a while.
Absolutely.
I think this is a very important point that you make, that it can take time. I remember we had the situation also with one of my daughters, and we thought we would have an appointment within, you know, a week, 2 weeks, and it took a few months to really get to the right person. May I ask that there are early interventions around the world, right, for children? Can you tell us more, starting of what age would you recommend maybe to see a speech therapist when there is a doubt about this, maybe from 24 months onwards? Or
well, I'd say before that, Uta, because like we can assess children from very early, and like, you know, speech and language therapists actually work across the lifespan. So we work with babies who are premature and have trouble feeding, and, you know, communicating with your baby if they're in an incubator over a long period of time because they were premature, all the way through to, you know, people with dementia and the end of life and not recognizing food. So like our remit is really broad. I would say sooner rather than later, because waiting lists tend to be like quite long in places, and in Ireland in particular, like at the moment, speech and language therapists are being redeployed to do COVID testing, so services have stopped for some people. So I would say don't delay from the point of view of I think you're better off to be in the system early and not need the appointment than to be, you know, 24 months and going, oh, hang on, we won't be seen for 6 months. Do you know what I mean? And I think if you are worried, you're better off to act sooner rather than later, so we can reassure you. Like, for example, I had a new mum recently send me some videos of her little girl who's 6 months old. There's no reason for her to be concerned other than she's a first-time mum and really wants to get it right. So I was able to give her some kind of tips for like just making the interaction more turn taking, more to and fro and not kind of testing. And the baby was only 6 months old, but she was doing 6 months olds do a lot, you know, when it comes to interaction. So I would say to put your own mind at ease sooner rather than later, because we can do intervention from very early on in terms of coaching parents around the styles of interaction that are more conducive to language learning.
You touched on this a few times about how can a speech and language therapist deal with multilingual children when they do not know all the languages themselves, because you can have very many languages in a family and you can't always expect to find a therapist with that language combination. So how does that work?
Yeah, I was thinking about that as well, Rita, you know, and like the speech and language therapist does not have to be multilingual in order to deliver a culturally competent service. So the key thing is, let's say, for example, if I'm going to see a child who speaks Polish and English, I have a professional responsibility to go and find out about Polish and what are the speech sounds in Polish. How is it different from English, let's say? What have they got in common? What about the grammar of Polish? Because if I'm seeing, let's say, a 5-year-old whose word order seems unusual to me in English, then I need to think about, well, maybe it's just a reflection of word order in Polish, for instance. And there is a very good book called Difference versus Disorder by a group of Texan speech and language therapists, I think, or speech and language therapists in Texas. And they have a range of languages in that book where they go through the speech sounds, kind of the development of grammar. So the therapist needs to do that like first, you know what I mean? In order to work out, because the diagnostic dilemma from the speech and language therapist point of view is this a typically developing child who's just exhibiting signs of the languages interacting with each other as they do naturally? Is it that they haven't had enough exposure to the community language, the language of their education? Or do they have what's called the developmental language disorder if we're talking about language? But it's the same for speech. Is it just the languages interacting with each other, or have they got a speech problem? And again, you know, there are lots of resources out there. Like there's a great Australian website called Multilingual Children's Speech. It has information on loads of languages. The American Speech Hearing Association has lots of information for speech therapists on working with bilingual, multilingual families. And we have a professional obligation to develop our cultural competence, which I think also involves asking the parents, does this sit right with you? What are you concerned about? You know, what is not culturally appropriate for me to do when I'm meeting you? How would you like me to address you? Are there certain topics that you're not comfortable talking with me about because I don't know you? How do you feel about a home visit? Is that, you know, not appropriate given your culture? I think it requires really the speech and language therapist to be open-minded, humble, and able to say, I don't know, but I know where to find out, and to be truly collaborative and creative. I think it just makes your job really interesting.
Yes, and this touches one of the questions that has been asked, where Andrea asks, are there certifications or specializations we need to look for in a therapist, especially if the child is bilingual or multilingual? So I think
Okay.
it would be at some point, I don't know, I had it now in mind, there would be a list of questions that we as parents would have to ask these specialists in order to find out if they are a good match for us. Because I think this was one of my first mistakes that I did. I said, okay, this is a person who knows what he is doing. And then find out a few months later that it was not a good fit. So
Absolutely.
I think it's actually what you just said, that you find really the specialist that, yes, has some kind of empathy for the family and the situation of the child.
And that's a good fit for you, yeah.
But
I need to say as well, you know, in defense of speech and language therapists, right, that part of the challenge as well is that the healthcare system does not give space to therapists to develop their cultural competence, because the fact of the matter is, if I'm working with a family from a culture that I'm not familiar with, I have a lot of homework to do to make sure my practice is culturally sensitive. And if I've got a big long waiting list and I have like statistics that I have to return at the end of the month saying I have seen X number of children, where is the space in the system, you know, to allow me to do that? So they're like, but that being said, I think particularly now at this stage, there's no excuse not to be delivering a culturally competent service because there's so many resources available. But it does take longer because you have 2 or more languages to take into consideration, and you have to find measures that are maybe difficult to access. So, just to bear that in mind as well.
So if we understand you correctly, there is no specific certification for bilingual or multilingual therapists.
Now, not that I know of, right? Not that I know of. However,
specialization.
Yeah, like in the States, there is, I came across recently, I think it's called the Leaders Project, and that is from a university in the States. I can't remember now where exactly. And they did seem to have a bilingual certification. And there is certainly, there is a speech and language therapist on Facebook who has a group on evidence-based practice for speech and language therapists, Tatiana, I don't know her surname, but I think she has a qualification, I think, I could be wrong now, that's specific to working with multilingual children. In Ireland, there isn't one, but I imagine in the States there could well be.
That would help, I think, the parents, if we know that this therapist has this extra certification, then, you know, since we're already on such long waiting lists, and then, you know, once we actually get our therapist, we find out she has no background in that. Anyways.
But you know, Tetsu, even if she doesn't have the background or he doesn't have the background, they could still deliver a culturally competent service as long as they're open-minded enough to collaborate with the parents as the experts on their language and their culture and their child. Do you know what I mean?
Yes, absolutely. Absolutely.
Because I would say, sorry,
no, sorry, please.
I was just going to say, like, when I did my degree, I learned nothing about working with multilingual children, and Ireland is a trilingual nation, so I learned nothing about working with Irish speakers, absolutely nothing. But it never made sense to me that you would tell somebody to stop using two languages if that's what they were using in their daily lives. Do you know what I mean?
Yeah, that is, however, one of the big worries that people or parents have, that they're being told. I am among them, who we had 3 languages in the family, and we were told to skip all but one and stick to one only, and that is, I'm afraid it's still today. So I just to reiterate for anyone who's not listened from the start, delay, bilingualism does not mean delay, and you have the right to question if you get advice that don't feel right. For example, being told to skip languages in the family, you have the right and you should do it. You should have the confidence to do it.
May I ask the last question that is very dear to me and you, Maripet, actually, from Edel. Is language delay more common in twins?
Oh, yes, no, not yes, it is, but yes, interesting question. Not a lot of recent research in this, as Uta and myself have been discussing, and there is this kind of idea of what they call the twinning effect, so that at around age 2, if I remember correctly, they may be experiencing what's called like a transient delay, but that generally by age 3 and beyond, it's kind of resolved. So it's something to watch out for. It doesn't mean they're going to have a delay. Significant things would be like, were they premature or low birth weight? So the speech and language therapists kind of need to know that, so that if they were seeing, let's say, a 2-year-old twins, that you'd think, oh, maybe this could be transient. So let's keep an eye on things and see how things progress. And actually, I do have a blog post on Talk Nua about language development in twins with more specifics from the research, and another one on multilingual twins, but there's very little on the multilingual twins language development. But the significant thing, I think, with the twins is if they were premature and low birth weight, as opposed to specifically being twins, would say.
I know you said it was the last question, Ute, but there was one thing still we had that I really wanted to hear your opinion on. How would you see this profession going forward? What would you like to see more in the training to get everybody, not only monolingual parents, but parents of bilingual and multilingual children, also be more confident that they're going to get good advice?
Well, I was thinking about that last night, Rita, on my walk down to the beach, and I was like, right, if there's any, billionaire philanthropist in the audience who wants to fund this, this is what I would like. So I would love if, like, the speech and language therapy degree program started with working with multilingual families from the very first day across all subjects. So looking at let's say if you're talking about neuroanatomy, you're looking at neuroanatomy and neurophysiology as it relates to multilingual children and multilingual adults. Assessment so I'm just thinking of the course that I teach on, there is primarily a monolingual focus, but myself and another colleague fly the multilingual flag like all the time. But I'd love if it was woven much more like through each communication disorder, through things like culture to do with feeding, eating, drinking, and swallowing, and how to work, around cultural issues in those kind of scenarios. And I'd love to have parents of multilingual children coming in, talking about their experiences, and really showcasing the detrimental effect telling parents to stop speaking a language has upon people, and the stress and distress that causes, to really make it real, you know, to bring it home to individuals. I'd love cultural competence training to start on day one, cultural awareness exercises throughout the program. That would be my kind of like vision, really, you know.
Hopefully we can get there. I think those are all fantastic ideas. I think we could go on for another hour, but
Indeed.
but I think it's time to wrap up.
Yeah.
Just to finish it all, Mary Pat, do you have something, a message that you would want to give to parents of bilingual and multilingual children?
Absolutely. So, like, a couple of things. One would be to remember that the children don't get confused when it comes to languages. So they're wired to acquire languages. So that's what they're designed to do in a way. So they don't become confused. You're not doing anything wrong by speaking your languages. And actually, I think a nice trick for when you're meeting the healthcare professionals is to talk about the languages that you need, because if you're saying, well, we need 3 languages for, you know, for our everyday lives and for our child to participate in all of their contexts, it's very difficult for a healthcare professional to argue against that, because you've said this is what we need. And to be really reassured that it doesn't cause any problems, and to think that the problem might actually be with the professional you're meeting, unfortunately. Do you know what I mean? But I think that's like general, irrespective of whether you're talking about going to your GP about something. Do you know what I mean? That we have a tendency, we've been conditioned to trust the expert and to put too much kind of faith in them, and that it can be disconcerting then to go, oh, but I thought they were the doctor, they knew, you know, and it can be upsetting to go, hang on, I actually don't believe what they're saying at all. So to not give up, and to not be afraid to look for the right fit.
Yeah.
Because
Fantastic.
yeah.
Thank you so
Wow.
much, Mary Pat. Thank you.
Thank you.
You're very welcome.
Again, I think we've had another wonderful discussion, lots of insights, and we want to acknowledge our participants also, well, our viewers. Thank you very much for everybody who's put in lots of fantastic questions. Andrea, Pipa, Josie, Edo, thank you all. And I do want to mention that everything that has been said, so key highlights will be put into show notes, which will be on our Facebook page. It's already there. If you want to check on our Facebook page, it's pinned to the top and in a post, and we'll also link it into the description here also. And later, I will also put in a little link for feedback. If you could provide us some feedback to our sessions, that would also allow us to improve our contents. And if you have maybe some suggestions, recommendations, that would also be much appreciated. So once again, thank you very much, Mary Pat. This has been super insightful. And it is now time for us to look to the future. I will share my screen, and Rita will tell us about our next speaker.
Indeed.
Give me a second. There you go.
Here we go. Yes. So another exciting episode in 2 weeks from today. We have Professor Arturo Hernandez from the University of Houston. He's a professor of psychology since 2003. And his main research interest is in the neural basis of bilingualism, with the emphasis on developmental perspective. It might sound very complicated, but I promise we will keep it on a level so we can all follow it. His recent work has looked at the role of genetics and bilingualism in how they affect a person's ability to flexibly adapt their thinking and learning, so any cognitive tasks. He is also the author of the book, The Bilingual Brain. So that's a really good book with a lot of interesting information in it. So the topic will be how do children and adults learn languages differently? So please do join us and come with your questions. I think this is a topic that we have quite often mentioned, or it has come up when you think about parents teaching their children a language, or our children acquiring, and how. So we will be speaking more about all of those aspects in 2 weeks' time.
Already looking forward to 2 weeks from now. Once again, same time. It will be next Tuesday in 2 weeks at what is this? 1 p.m. Montreal. It's 6 p.m. UK and 7 p.m. London.
Well done.
Hope to see everybody here to watch our session with Dr. Arturo Hernandez. Thank you very much once again, Matt and Pat, and we will see everybody
Thank you.
next time.
Oh, thank you for
Thank
having me.
you.
Bye-bye.
Bye.
Bye.
Bye.